Hi, I'm Dr. David Hill, and today we're talking about concerns with soy formula side effects. Now, there's a lot of publicity right now to isoflavones in soy. These are chemicals that are found naturally in many beans and at especially high concentrations in soybeans that, when consumed, can mimic the actions of the hormone estrogen in the body. And parents are increasingly worried, can these isoflavones do something to my child, affect their reproductive health, cause them to develop tumors? The good news is that this has been studied pretty thoroughly, and so far as we can tell, the concentrations of isoflavones found in soy-based formulas are not high enough to have any significant physiologic effect on the baby. There's no evidence that soy formula contributes to tumors, developmental problems, or issues with sexual organ development in babies. A second concern with soy formula side effects has to do with aluminum content, which is comparatively high in soy formula. Again, this has been studied, and while some people are concerned about the possible effects of aluminum on bone, the studies have been very reassuring. So far, the effects of aluminum in soy formula have not been found to be significant in babies. Now, there are some other things that we do think about with soy formula. One is if your baby is on thyroid medication for having a low thyroid level. This is a very rare condition, but it may affect your baby. They probably shouldn't be on a soy formula because it interferes with absorption of the medication. Likewise, if you have a preterm or very low birth weight infant, it's not clear that they're going to get very good bone development from soy formula, and you should talk to your pediatrician about finding something that works better for you. Other people are concerned about allergies to soy protein, and this is a real issue. Soy protein allergies occur in about 1% of children who drink soy formula, as opposed to about 3% of children who get milk protein allergies from cow's milk-based formula. So it's real, but it's relatively rare. It certainly can happen. Likewise, there can be an intolerance of the soy protein in the formula that leads to severe vomiting, diarrhea, even blood in the stool. The same thing can happen with cow's milk formula, and if your baby has symptoms like that, you should definitely talk to your doctor about what other alternatives there are for you. To summarize, soy formula probably does not cause any effects due to estrogen-like chemicals called, there are so many of them, isoflavones, the one I'm thinking of. Also, the aluminum in soy formula does not seem to have deleterious effects. However, if your baby has a soy protein intolerance, soy allergy, is premature, or is on thyroid medication, you should talk to your doctor about another alternative. Talking about soy formula, I am Dr. David Hill.